So dear student, this is a typical rib, and first of all very important to know about the side determination of the rib. So we should know that this rib has an anterior end, it has a body and a sharp body which is curved outward, then it has a posterior end, and this posterior end has a neck, has a head and has neck, and the tubercle which is present over here. So this which is present over here, so this is the tubercle of the posterior body. Then it has the two borders. The upper border is rounded and lower border you can see over here. This is the lower border, and this lower border is sharp. In you can see over here, this is the sharp lower border and the rounded upper border. So by placing this rib in its position, you can well identify the anterior end, it is curved outward, the posterior end, its head, its neck, its tubercle, the angle of the rib, the upper border which is rounded, and the lower border which is sharp. So this is the rib of the right side. Then then I show you the head. So in the head you can see the two facets are present on the in the head area, and these facets, the lower facet articulate with the vertebra of its corresponding number, and the upper facets articulate with the vertebra one level above its corresponding level. Then on the tubercle, you can see again the tubercle has two areas. The medial area is rough, and this rough area articulate with the vertebra forming the costovertebral joint, and the posterior area is smooth where it is attached to the ligament. Then this one is the upper border of the rib, and here you can see the lower sharp border of the rib, and on inner aspect of the rib you can see that there is the groove which is present. This groove is for the neurovascular bundle in which nerves and blood vessels are present in it. So this is the typical rib which and its features. In contrast to this typical rib, the first rib which is different from this typical rib, because as this typical rib has the upper and the lower border and the inner and outer surfaces, in contrast to this the first rib has upper and lower surfaces and inner and outer border.